We all want to feel secure, don't we?
Yeah.
Especially about the quality and safety of our healthcare.
Absolutely. It's fundamental.
So today, let's really get into it. We're diving into ISO 9001 and exploring how it shapes quality management in the healthcare world.
Yeah, it's interesting because ISO 9001, it's used everywhere, right? Across so many industries. But applying its structure to healthcare, well, that's our focus. We want to unpack what ISO 9001 really is and how it helps hospitals, clinics, you name it,
Right.
consistently meet the needs of, well, everyone involved. Patients, obviously, but also their families, the healthcare pros themselves, and, of course, satisfying all of those regulations.
Exactly. ISO 9001, it's that globally recognized standard for quality management systems, or QMS, part of the bigger ISO 9000 family.
Right.
And while, like you said, it's big in manufacturing, tech, whatever, we're honing in on healthcare today, how it helps with patient safety, making care delivery smoother, and just making the whole organization run better.
And getting that ISO 9001 certification, that's a really strong signal, isn't it?
It really is. It shows a deep commitment to improving quality, optimizing how things are done, and ultimately making sure patients are satisfied.
Definitely. It's more than just a piece of paper. It reflects a genuine shift towards a quality culture.
Yeah.
And, driving that are 7 key principles.
Okay, let's break those down. First up, customer focus. Now, customer in healthcare, that's a bit different.
Yeah. It is. It's broader. It's not just the patient paying a bill. It's about prioritizing the needs, the safety, the whole experience of everyone interacting with the system.
So the patients.
Patients first and foremost, absolutely. But also their families, who are often so involved. And the doctors, nurses, all the staff delivering that care. They're part of this equation, too. It's about being truly patient-centered, responsive to feedback from all those groups.
That makes a lot of sense. Okay, second principle, leadership. Seems pretty crucial.
Oh, absolutely essential. For a QMS like ISO 9001 to really work, you need leaders at all levels who are, well, genuinely committed.
Not just paying lip service.
Exactly. They need to set a clear vision for quality, build a culture where everyone feels accountable, and make sure quality isn't just a side project, but part of the main strategy.
Got it. Then there's engagement of people, getting the whole team on board.
Precisely. You can't just dictate quality from the manager's office. It needs everyone actively involved.
How do you achieve that?
Well, things like good training, making sure people feel motivated, and crucially, creating an environment where staff feel, empowered to suggest improvements. Like they see something that isn't working, they can speak up.
Fostering that collaborative spirit.
Yeah, breaking down those silos between departments.
Okay, fourth one, process approach. What does that actually look like day to day in a hospital?
This is where it gets really practical. It's about looking closely at all the steps involved in, well, everything.
Like admissions.
Like admissions, yeah. Or the pathway for treating a specific illness, administrative tasks, even how medical records are handled. You map it all out to find the kinks. Where are the bottlenecks? Where could errors happen?
Right.
And then you optimize it. Think about, say, the discharge process, making sure instructions are super clear, follow-ups are booked, meds are sorted properly.
Right. Streamlining things to avoid mistakes. Makes sense. Number 5 is improvement.
The continuous improvement cycle. It's core to ISO 9001. Never just being satisfied with good enough.
So always looking for ways to do better.
Always. Evaluating how things are done now, clinical practices, patient outcomes, how efficient things are, and then making changes, innovating and checking again. It's embedding that mindset,
Okay. 6th, evidence-based decision-making. Using data, basically.
Exactly. No more just relying on gut feelings or, well, we've always done it this way.
Right.
ISO 9001 pushes you to use solid data, tracking patient outcomes, collecting feedback systematically, doing regular audits, monitoring those performance indicators.
KPIs.
KPIs, yeah. Using all that evidence to guide decisions about care protocols, where to put resources, operational tweaks, like tracking post-op infection rates to refine surgical safety.
I see. And the last one, number 7, relationship management. Who are we talking about here?
It's about managing all the key relationships. Patients and families, obviously clear communication, meeting their needs.
Sure.
But also external partners. Think suppliers, pharmaceuticals, equipment. You need reliable, high-quality partners.
And regulators, too, I imagine.
Definitely.
Yeah.
Maintaining open lines of communication and ensuring you're meeting all the standards and guidelines.
Okay, so those 7 principles really paint a picture of how you build quality into the fabric of an organization.
They provide a really solid framework.
And to see this in action, we actually have some great insights from the QI Playbook podcast. They featured Mr. Ajay Malhotra, quality manager at Medicare Hospital. They went through the ISO 9001 certification recently.
Yeah, his perspective was really illuminating. He actually called achieving the certification a game changer for them.
Game changer, wow.
He talked about how they systematically built their quality management system, making sure it lined up with the ISO standards. It meant like a deep review of everything.
Everything.
From the moment a patient walked in the door, admission, through all their treatment, discharge, even the billing side of things. Every step was looked at.
That sounds intense. He also mentioned KPIs, right? Key performance indicators.
Oh, big time. A major focus was identifying the right KPIs for every single department, and then not just tracking them, but constantly looking for ways to improve them.
Okay, so what was the payoff? Did it actually improve care?
He strongly emphasized that it did. Tangible improvements in clinical outcomes.
How?
By doing things like streamlining care pathways, finding the most effective, evidence-based way to treat conditions and standardizing protocols.
Standardizing, like checklists.
Exactly. He gave a great example. They brought in a standardized surgical safety checklist.
Ah, like the WHO one.
Similar idea, tailored for them. And he said it was instrumental. It directly led to fewer errors during surgery, boosting patient safety significantly.
That's powerful stuff. Real-world impact. Did he talk about the people side of it too? Leadership and staff?
Absolutely. He stressed how crucial it was that leadership didn't just sign off on it, but actively championed it, communicating why quality was important constantly.
So real ownership from the top.
And engaging all the staff. Regular training, yes, but also empowering them, making them feel like they could actually suggest changes if they saw a better way to do things.
And didn't they set up a specific team for that?
They did. A quality improvement task force,
Yeah.
a QI team.
Okay.
Had people from different departments on it, bringing different viewpoints.
Yeah.
Their job was basically to hunt down inefficiencies and propose solutions, always focusing on safety, cutting wait times, making patients happier.
So based on that whole experience, what advice did Mr. Malhotra have for other hospitals thinking about ISO 9001?
He had some really solid points. First, it's a long haul, not a quick fix. You got to be committed.
Right.
Second, really understand the principles. Don't just tick boxes. Third, leadership buy-in is non-negotiable. Fourth, make sure every single staff member knows how their role fits into the quality picture. And fifth, remember, continuous improvement isn't a project. It's just how you operate from now on.
That's great advice. Okay,
Yeah.
let's zoom out a bit. If a hospital goes through all this, gets certified, what are the main benefits they can realistically expect?
Well, the benefits are pretty significant. Number one has to be better patient care.
How so?
Through those smoother processes we talked about, reducing errors, and just that overall heightened focus on safety.
Okay, what else?
Staff morale often gets a boost too. When things run well, systems are clear, people can actually focus on caring for patients instead of fighting fires or dealing with chaos. It's less frustrating.
I can see that, a less stressful environment.
Definitely. Then there's better regulatory compliance. The framework helps align everything with local, national, international standards.
Good point. Any financial benefits?
Often, yes. Cost savings can come from cutting out waste, identifying those inefficiencies, using resources better. It might not be immediate, but over time it adds up.
Right.
And finally, that evidence-based decision-making we mentioned, it leads to smarter choices, improving both clinical results and how the hospital runs overall.
Okay, so if you had to boil it down for our listeners, 3 key takeaways about ISO 9001 in healthcare.
Okay, 3 things. First, ISO 9001 gives you a really solid, proven structure for a QMS that genuinely improves patient care, safety, and efficiency. It works.
Got it. Number 2.
Got it. Those core principles, customer focus, leadership, continuous improvement, they're not just jargon. They are absolutely essential for any hospital serious about raising its quality game.
And the 3rd.
Third, getting certified isn't just about the certificate. It signals real commitment, and it brings tangible wins like better patient outcomes, smoother operations, and often cost savings.
It's clearly a major standard globally.
Oh, huge. Over 1 million certificates issued worldwide, something like 189 countries.
Wow.
And while it's not usually required by law in healthcare,
Right, it's voluntary.
the fact that so many organizations choose it says a lot about its value and showing that commitment to quality.
And it's not just a one-and-done thing. You get certified and relax.
Not at all. The whole point is establishing, implementing, maintaining, and continually improving the system. It's dynamic.
Constantly evolving.
Exactly. Always focusing on patient needs, keeping leadership involved, thinking in terms of processes, and driving that improvement cycle.
And how do they make sure it's actually working? That the system isn't just on paper?
That's where internal audits come in. They're crucial. Regular checks to see if the QMS is really doing what it's supposed to, achieving the goals, delivering results.
And the standard itself gets updated, right? To keep up with the times.
It does. Like any good standard, it needs to evolve. The current version is ISO 901.20114.
2015.
Yeah, but there's a revision planned, expected around September 2026.
Ah, okay. So soonish.
Relatively. It'll aim to incorporate, current best practices and challenges, and hospitals certified to the 2015 version will get a transition period to adapt.
Okay. And you mentioned the ISO 9000 family. Are there other related standards specifically for healthcare stuff?
That's a really important distinction. ISO 9001 is the general framework, but yes, there are sector-specific ones, like ISO 13485.
What's that for?
Medical devices. It's much more focused on device safety and meeting very strict regulatory requirements for things like implants or diagnostic equipment.
So more specific than the general quality approach of 9001.
Exactly. ISO 9001 is the broad foundation. 13485 drills down into the specifics for medical tech.
Okay. No, ISO isn't the only game in town when it comes to healthcare quality and accreditation, is it?
No, definitely not. There are other very significant players. Joint Commission International, JCI, is a huge one globally.
JCI, right. Heard of them.
They're seen as a world leader in healthcare quality and patient safety. They accredit, over 1,000 programs in more than 70 countries.
What's their main focus?
Their mission is really about helping organizations reach and maintain the absolute highest standards. Big focus on international best practices and specific patient safety goals. They've got a conference coming up too, Unified 2025.
And hospitals seem to value that JCI stamp of approval.
Oh, absolutely. We heard from hospital leaders, didn't we? People saying it boosted teamwork, improved coordination.
Right, like Alex Lon in Hong Kong calling it a great team-building exercise.
Exactly. Others mentioned increased community confidence, better risk management, like Shiji Kurian at Burjul Farha.
And boosting patient confidence, aligning with international standards.
Yeah, Imad Sedek from Emirates Hospitals and Roxana Fulton at Cornish Hospital echoed those points. It clearly signifies a commitment to excellence for them.
So JCI is a major international force. Any other key bodies?
Well, in India, there's NABH, the National Accreditation Board for Hospitals and Healthcare Providers.
Okay, specific to India.
Right. Part of their quality council, setting standards and accrediting healthcare organizations there.
And any others with a broad global scope like JCI?
There's ISQA, the International Society for Quality in Healthcare.
ISQA.
Yep. They're a nonprofit, been around for over 30 years, focused on promoting quality improvement worldwide through things like education, sharing knowledge, external evaluations. They also have a big international conference planned for October 2025 in São Paulo.
It really is a whole ecosystem focused on quality, isn't it?
It is. Lots of different approaches, but all driving towards that same goal of better, safer care.
And I guess there are consultants who help hospitals navigate all this, these standards and accreditations.
For sure. Companies like Supremedic Consultancy, for example. They help hospitals with things like getting ready for NABH accreditation, providing support through the process.
Right, helping them meet the requirements.
Exactly, offering expertise to achieve those quality benchmarks.
Okay, so wrapping this all up, what's the big picture message from our deep dive today?
I think the core message is pretty clear. Putting a strong quality management system in place, whether you use ISO 9000 or go for JCI or NABH or another framework, it's a fundamental step. It's how healthcare organizations commit to providing safer, higher quality care for everyone.
But it's not easy. It's a journey.
Absolutely not easy. It's a continuous journey. It needs real commitment, top to bottom, side to side, within the organization. It's ongoing work.
So something for you, our listener, to think about. With this huge global focus now on healthcare quality and patient safety, what role do you think these big international standards and accreditation bodies, like the ones we've discussed, will play in really shaping how healthcare is delivered around the world in the future?
It's a great question. How much influence will they have? How will they evolve?
Definitely food for thought. And if you want to dig deeper, you can always check out the websites for ISO, JCI, NABH, or ISQA. Lots more information there.